In Canada, hospital infections kill 8,000 to 12,000 Canadians every year. We're at South Shore Health today with infection control practitioner Suzanne Rhodenizer-Rose. What has South Shore Health done in the past to combat hospital-acquired infections?
Between the two practitioners that are working here, myself and Elizabeth Watson, we've done a lot of hand hygiene education over the last few years to try and educate healthcare workers as well as patients and the public about what they need to do to protect themselves and to protect their patients from transmitting infections. And hand hygiene is one of the biggest factors that we've tried to educate people on. It's the single most effective way to prevent infections. It's easy, it's simple to do. We just need to get people more aware of it and doing it properly.
You've been running the program It's Okay to Ask now for a couple of years.
Mm-hmm.
How's that going?
It's going quite well, actually. It was a program, maybe we can backtrack, because the program was actually endorsed by a task force that we had set up in the hospital, specifically related to dealing with MRSA, or methicillin-resistant Staphylococcus aureus, which is a particular type of bacteria that we deal with in the hospital. It's nothing new, and it's in all hospitals all across the country, but we had a bit of an issue with it here at South Shore Health, and we established a task force to deal with some of the issues and put some practice changes in place through the task force. And the It's Okay to Ask program was actually one of the campaigns that this task force moved ahead with. And what it is it's a program targeted directly at patients, their families, and the public, trying to empower those people to be part of their care and to let them know that it's their right to ask for safe care, and safe care involves good hand washing practices from your healthcare worker, whether it's a nurse or a lab technician or your physician or the surgeon or whoever is dealing with you. So what it is involved is a lot of posters and educational information, but also we have taken a video that was pre-done, and It's Okay to Ask video, and the volunteer services program goes around and shows all the new patients and their families this video, and it gives patients and their families helpful tips that they can use when they're interacting with their healthcare worker to say, can you make sure you wash your hands before you deal with my dressing, or that kind of thing, so that it's a positive approach to holding people accountable, basically.
What can patients do to protect themselves while they're in the hospital?
First, let's recognize that 1 out of 9 patients in Canada every year who are admitted to hospital pick up an infection during their hospital stay that's not related to what they were actually admitted with. Patients can protect themselves by doing their own good hand hygiene practices, whether it's going to a sink and washing their hands with soap and water, or using a lot of the alcohol hand sanitizer stations that we have throughout the building. They're strategically located by the elevators and in the hallways and outside patient rooms. It's sometimes hard for patients to get up and do good hand washing because they're in bed, and a lot of healthcare workers are doing things to them, but it's also a good thing if patients can get up and wash their hands as well afterwards. And certainly we ask visitors when they're coming in, if they're feeling unwell, if they've got respiratory symptoms, or if they're having any kind of illness, that they stay away from the hospital, because a lot of times people come in and they're feeling unwell, and that's how things tend to spread in hospitals. So there's a few things that patients can do.
I understand there was a new campaign launched recently. Can you tell me about that?
Certainly. Canada has recently launched a national hand hygiene campaign, and a lot of national agencies have taken part in developing this particular program, including the Public Health Agency of Canada. And what it is a collaborative that healthcare facilities can join, so that there's a lot of teamwork and sharing of information and ideas on how best to get the information out there to mostly healthcare workers, but also to patients and the public about why it's important to wash your hands and how to do it appropriately. So what comes along with that campaign, it's called Stop Clean Your Hands. And that campaign comes up with a lot of educational tools and videos, and there's actually online tutorials that healthcare workers can go on to our hospital intranet site and do the online tutorial and learn a little bit more information about why it's important to wash your hands and what they need to do to protect their patients.
Can you demonstrate for us how to properly wash your hands?
Sure. So when we teach people to do good hand washing practices, first we get some soap, turn on the tap, wet your hands a little bit. It's really important that you get all surfaces of your hands and around your wrists, paying particular attention to in between your fingers and around your thumbs and the palms of your hands and also the backs of your hands. And those are some of the key places that a lot of people miss when they are washing your hands. You need to do good soap and water contact for at least 10 to 15 seconds for the soap to actually work with the bacteria on your skin to get rid of it. And rinse your hands. Dry your hands off with paper towel. And it's more important to pat your hands dry rather than rub because that tends to dry your hands out more and it's more abrasive to your hands. And then you use your paper towel to turn the tap off so you don't recontaminate your hands. Another effective means of doing good hand hygiene is the alcohol hand sanitizer, which we have located in many areas within the hospital. You take 1 squirt, and the same as soap and water, but it's with the alcohol. You make sure you get all surfaces of your hands in between your fingers and the backs of your hands and rub it in until it's basically dry. And alcohol is, some studies actually show that alcohol hand sanitizer is more effective than soap and water in a healthcare setting.
Thank you for joining us for Face to Face. I'm Paula Levy for SouthShoreNow.ca.